Well, shoulder pain is nothing to shrug off. Well, joining us today is Dr. Todd Melegari, with orthopedic specialist of Maryland at GBMC, to tell us what you should do if you're experiencing shoulder pain. All right, well, thanks for being with us. So tell our viewers, what are some common causes and symptoms mostly associated with shoulder pain?
So probably the most common cause is overuse. As we age, our tissues tend to break down, and then if we do too much, that leads to inflammation, and ultimately inflammation is the source of pain. And when it's coming from the shoulder, the rotator cuff, for example, it's usually over the side of the arm, and it's worse with things like reaching overhead, fixing your hair, putting on clothes, and simple everyday tasks like that.
Okay, and so what can cause that shoulder pain without any kind of injury? And then when should somebody start to worry about it?
So again, it's just caused by overuse. A lot of us tend to focus our lives on family and work, and then try to get busy on the weekends doing athletic things, and then that's usually when the problem comes. Or things we've seen during the pandemic, people all of a sudden have more time on their hands, and now they're interested in doing home repair projects. Typical treatment includes over-the-counter medications like Motrin or Advil, plus or minus Tylenol, heat and or ice. If those things don't work and the pain continues despite rest, then it's probably a good thing to get checked out by your doctor.
So there's a whole lot of terms that people may hear when they think about shoulder pain. Can you tell us the difference between frozen shoulder, bursitis, and then stiff shoulder?
So bursitis is essentially just inflammation of the bursa tissue. The bursa is a tissue layer that sits between the rotator cuff and the bone, and basically lets the shoulder move in a friction-free way. And when it gets irritated or inflamed, you have bursitis. Frozen shoulder is a little bit of a different issue. Basically, that has to do with the capsule. The capsule is the tissue that surrounds the joint being a ball and socket joint. And when that tissue gets irritated, it can basically become stiff, and then you don't have any shoulder motion. And that's the key to diagnosing a frozen shoulder, is that the shoulder doesn't move. It doesn't move if the patient tries to move it. If I, as the physician who am examining the patient, try to move it, it still won't move. It's literally stuck, and that's where you get the name.
Okay, now talk to us about any kind of surgical options that are out there if those conservative treatments are not effective any longer.
Yeah, sure. We tend to start with conservative treatment, like we said. Ultimately, if that doesn't work, then there's a chance that maybe you have an attritional tear of your rotator cuff. That can happen even without an injury. Imagine your favorite pair of jeans, the knee, you wear it year after year, and eventually the knee will wear out and you get a hole. Kind of the same thing can happen with your rotator cuff. And ultimately, if you do have a tear, that can lead to pain that doesn't get better with conservative treatment. And then you have the option to get it fixed with surgery. So that's probably the most common shoulder surgery we do in people. The other possibility would be if you have a worn out joint, you have arthritis. You can get a shoulder replacement just like you get knee replacements. They're not as common because the shoulder is not a weight-bearing joint, and it doesn't affect people as much as hips and knees. So we certainly don't see that as much, but it does happen.
All right, well, Dr. Melegari, it's such great information. We have all of the info where our viewers can find you right there on the bottom of our screen. This will also be on our website, foxbaltimore.com. We appreciate you being here with us today.
Oh, great. Thanks for having me. I appreciate it.